Welcome back. Is South Africa losing its battle against COVID-19? Well, more than 9,000 new cases have been recorded in the last 24 hours. Of that, more than 5,900 are from Gauteng. Daily deaths are over 100 and total fatalities are close to 58,000. So to discuss this matter further, let's bring in now Professor Koleka Mlisana, who's a co-chairperson of the Ministerial Advisory Committee. Prof, always a pleasure speaking to you. Welcome. How concerned are you with the country's size as well as acceleration of the COVID-19 third wave?
Good evening, Faith, and thank you for having me, and good evening to all the viewers. Yes, actually, we continue to be very concerned, especially, if you're looking at the previous, the last 3-4 days, we really have just seen this steep increase in cases. And what is also of concern, as you have already mentioned, is that today we're sitting at more than 9,000 cases just in 24 hours, and 64% of those occurring in Gauteng, in the Gauteng province. And we have seen this happening in the last 3 days, which therefore means we really just need to make sure that, we manage Gauteng province efficiently. Because what always happens, and we know this is going to happen, is that as we see the cases rise, then we're going to see the hospital admissions increasing. And specifically for the province, we've got challenges with hospitals in that, we still have got Charlotte Maxeke closed. And so the question is whether the healthcare system is going to be able to cope with increase in the, in admissions. And what we saw happening today as well in the numbers is that we're seeing even the Western Cape creeping up, because it's close to 1,000 cases in the Western Cape. So that's the other area that needs to be watched and looked at very closely. Yeah. So it's a great concern. And like we say, if we really don't manage this, then it's going to spill over onto the healthcare facilities. And obviously we know then if the healthcare system cannot cope, then we're going to end up with a lot more deaths than we really would like to have.
And then, Prof, what would be the appropriate intervention to mitigate against this exacerbated spread? What would you say? Would you say that we need maybe a stronger lockdown? Do we need to enforce the lockdown regulations even more? What is the advice that you would give to the country thus far?
Sure. So for me, there are different stages of how we need to manage this. Firstly, it is the fact that, we're getting cases. It means at individual level, people are not adhering to the, non-pharmaceutical interventions, because remember, transmission happens in the, within people. And so really my first port of call for me is ensuring that people, when we talk about social distancing, people have got to stick to that. And a lot of times you see people still not wearing masks, even now when we've been talking about the fact that the country has entered the third wave. So really we need to be accountable citizens as South Africans. And then the second level, as you are highlighting, then if people are not doing what they're supposed to do, then it actually forces other measures like getting into, stricter restrictions. And so the question is going to be, definitely there should be no huge gatherings. And even the numbers that we currently have, the question is, should we not be considering even, smaller numbers, because we can see that people are not adhering to the numbers. And then the question of the curfews, the question of, I know there's always a struggle about liquor, and so there's going to be a need for a very close interaction and discussions as to how do we then control that aspect. So really, in our opinion, we definitely need to get into stricter, restrictions right now until, we are over this wave. Otherwise, then we're going to end up with a caving healthcare system.
Yeah, and I can imagine that the problem as well, Prof, is further exacerbated by the fact that the announcement by the FDA says that we must get rid of a bunch of our vaccines, right, because they've been contaminated. Surely then we need a strategic plan to mitigate against even the slow nature of the rollout program. That must be the frustrating point. How are we with this rollout program?
Yes, that actually is another blow now that has just hit us, because we all had been anticipating for this 2 million doses that was going to be coming once we got the clearing from the FDA. But now that we don't have that, it really puts us in a very difficult position, because, as everybody has seen, the rollout has really not gone fast at all. It has been very slow because we've been having the restrictions in the number of doses that are in the country. Now, it means this is even going to be further. And And the question is going to be, how long is it going to take for the next production of vaccines to be available from Johnson & Johnson? And as you say, correctly so, we're going to need to then go back to the drawing board and see, yes, we've got the doses that are coming in from Pfizer. Where else then can we access, vaccines? And that's going to be the critical thing we need to do, because really, unless we can ramp up vaccination, we're going to have a challenge, and it's going to be a big challenge. We really had hoped that by now we'll be rolling out and there'll be, we'll be vaccinating masses. Especially, we have not even covered those that are at high risk. We haven't reached the 5 million of those that are over 60. So we really are falling way behind, and we need a new strategy to see where else are we going to get vaccines. How long is it going to take for the J&J? Can we get more doses from Pfizer? So all of those things are going to need to be explored, and we come up with, answers so that we're able to move forward.
Well, in the quest for answers, Prof, let's be honest. Has the Department of Health received a significant blow as a result of what's happened now to the Minister, Zweli Mkhize, who's now temporarily stepped aside, just from a leadership perspective? Though he's a political figure, he's also somebody that provides leadership and strategic leadership in that regard. How significant was this blow of him moving aside and having now a department having to run, many would say, headless? So what's going on there?
Well, firstly, I'm not a politician, no, work for the Department of Health, so I really wouldn't know the intricacies of what actually the impact this has had. But really, for one looking from outside, yes, it really has been a blow, especially because he had actually been with the, pandemic from the start. And so any disruption, is bound to actually cause everybody to be, unsettled and, at unease. But at the same time, when we do have an acting Minister of Health that has been put in place, and we have seen Minister Kubai Ngubane already, hitting the road running, because there really is no time for her to try and get used to whatever has been happening. But I mean, we already have had meetings with her in that she has met a joint Ministerial Advisory Committee for vaccines, as well as our committee, which is for COVID-19. And we've already greeted each other. So we're planning to have another meeting as the MEC on COVID-19, where we can update her and just actually see how we can assist. So really, from where we sit, we are here to give advice and to support the department and the minister. It doesn't really matter to us who is in the seat, but we just want everybody to know that we're here for support. And it's just going to mean, once then she gets to, into the feel of things, and we've already seen her visiting, different hospitals already. And so really it's just for us to say, we're here to support, and we'll see how to, how this goes, because we really have got a pandemic in our hands, and we just cannot have we don't have time to try and explain and try and understand what's happening, what is not happening. We just have got to hit the ground running.
Professor, I think that during this time I would not want to be in your shoes. I'll leave the shoes for you to fill. So thank you so much for joining us this evening, Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee on that matter.